Hello, my name is Delia Mayoral Medina, and this is my presentation about palliative care. For most people, palliative care is a term that instills fear due to the limited knowledge about the discipline and its connection with the end-of-life care. However, palliative care is an interprofessional discipline that focuses on improving patients' quality of life while suffering from severe, complex, and often terminal illnesses. This care model addresses the patient's needs, partners, and support network during advanced illness and bereavement. The interprofessional team comprises physicians, advanced practice registered nurses, social workers, chaplains, and all the others involved in the end-of-life care. The early founders of the movement in the United States were inspired by the work of Dr. Dame Cicely Saunders and the writings of Elizabeth Kubler-Ross. Palliative care offers expertise in safe pain management, physical symptoms management, and emotional and spiritual care, and educate patients and caregivers to improve their experience while transitioning across care settings. According to studies, early palliative care is crucial to improve patients' quality of life, decreasing symptoms intensity, and lowering depression and anxiety in patients and caregivers. Findings suggest that it may extend survival length. The role of the professional nurse is to provide nursing interventions in direct care, including but not limited to symptoms management, comfort measures, and education. As interprofessional team members, nurses create a personalized care plan for patients and everyone involved in their care. Critical thinking is used in all aspects of the nursing process to deliver palliative care while maintaining the patient's dignity, autonomy, and hope. Palliative care is delivered by nurses in the patient preference setting, including their private residency, inpatient facilities, or any other place they choose. One of the most common barriers to palliative care is the need for an educated workforce, since the generalist nurse is not commonly trained to provide primary palliative care. This is more evident in rural settings such as most of Alaska. Obtaining palliative care, often perceived as a cumbersome and expensive, is another barrier to obtaining it. Still, most private insurers, Medicare and Medicaid, cover palliative care services and durable equipment. Hence, the importance of educating patients and their support networks during the earliest stages of their disease. There is no denial of palliative care physical, psychological, and emotional benefits. Furthermore, appropriate palliative care can also reduce the economic burden for the families and healthcare facilities by avoiding using resources such as the emergency room visits and inpatient admissions to provide comfort care that can be provided in a compassionate hospice setting. Please notice that the term hospice does not refer to a brick-and-mortar building, but to a setting where palliative care is given. Estimates indicate that 12 million adults and 400,000 children in the United States need palliative care at the end of life. Sadly, there are not enough healthcare providers to satisfy the growing demand. According to the Center for Advanced Palliative Care, Alaska only has 3.8 certified palliative care prescribing providers per every 100,000 inhabitants. Often, a good death at home is set as an outcome for the patient, their support network, and the palliative care team. But it is often unattainable due to the lack of resources. In Alaska, hospitals located in urban areas can somehow accommodate the needs of the dying. Still, smaller facilities in rural areas do not count with those services, and they are forced to send patients to receive end-of-life care in facilities located in Anchorage, where they spend most of their time alone and without family support. It is imperative for us nurses and healthcare providers, the general public, and our government to advocate for the expansion of the much-needed comprehensive palliative care services in our state. But to achieve it, we must educate ourselves and the community and actively seek legislation that allocates resources and encourage healthcare providers to enter the palliative care workforce to facilitate the provision of care not only in urban places but in every area of need. This rose honors my home facility program, No One Dies Alone, where a rose is placed in the door of a dying patient to ensure the presence of a family member, caregiver, or volunteer at any given time, so no one has to die alone. Thank you.